just taken delivery of my new Cytoplan order. This is where I get most of my vitamins from. Talk about that in a minute. But one of them that I take every day is vitamin D, and I will talk to you about why that's so important. So vitamin D does lots of different things in the body, but the main ones people take it for are immune health, bone strength, and improving your mood, stopping seasonal affective disorder, which is when you feel flat and low during the winter. So I want to talk about each of those briefly. First of all, bone health. So that's one of the main reasons we recommend this to our chiropractic patients, especially older patients and especially postmenopausal ladies, because it helps to keep your bones strong by helping you absorb calcium into the bones properly. So a lot of menopausal people or people with osteoporosis get put on calcium tablets, supposedly to help them absorb more calcium, but they're not having enough vitamin D, which means that calcium goes to waste, because you need enough vitamin D in the body in order for the calcium to actually get absorbed. Now the problem is, if you live in the UK, especially this time of year, you're not getting vitamin D from the sunlight like you otherwise would do. If you live in a very hot place, you walk around with shorts and t-shirts every day all year, you've probably got enough vitamin D. But especially in the UK, especially this time of year, most of us are not getting it. You can also get it from food, so you can get it from things like salmon, eggs, mushrooms, cheeses, things like that. But again, most people don't get enough vitamin D in their diet. So it's a very good idea to supplement it, especially if you know you're deficient. So there's bone health. Immune health is a really important one as well. And this got a lot of press. Vitamin D got a lot of coverage in the last few months because of COVID and all that. Everyone was talking about the immune system, not enough in my opinion, but vitamin D is very, very important for a strong immune system. And a lot of the people that became very ill with COVID were vitamin D deficient. And a lot of the populations who are generally more vitamin D deficient, which is older people and people with darker skin who don't synthesize it from the sun as much, were coming off much worse, of course. So great for your bones, really important for your immune system. But another reason people take vitamin D is because it lifts your mood. It helps to regulate your mood much better, especially again this time of year when you get something called seasonal affective disorder, or SAD, S-A-D. And that's when people just generally feel flat and low during the autumn and winter months. And a big reason for that is that they're not getting enough sunlight, and which means they're not producing enough vitamin D. So bone strength, immune strength, and mood. Now, so we recommend vitamin D to a lot of patients, and the best way to do this is to go to your GP and ask for a blood test, because they'll do a vitamin D blood test. You might need to ask a couple of times, and then tell us what the number is. So it's not enough to just hear back from the doctor or the nurse, oh, your vitamin D is fine, because the range that the NHS have of what's normal is wrong, basically. It's far too wide and far too low. So a lot of people get told that they are not deficient when in fact they are. Also, the type of vitamin D you need to take is really important. So with all supplements, what it's made from is really important, because the body absorbs some things better than others. And if it's made of cheap materials, then the absorption isn't going to be as good. Also, when you take vitamin D, it needs to be this type, vitamin D3, because that's the one that's so similar. That's the one that you make from sunlight. You need to take enough of it, and the one we recommend is, you don't have to remember this, I'll write it down, 100 micrograms or 4,000 IU. Now the ones you normally get from the chemist are 400 IU, which is enough to keep someone who's got enough topped up, but it's not enough to get a deficient person up to the right levels. It's just not enough. It doesn't matter how long you take it. So you need to be taking good quality stuff that's enough, and you want to be taking it with that as well, vitamin K2. You get K2 from leafy greens like cabbage and that kind of thing. The D3 absorbs more calcium into the body, but the K2 tells the calcium where to go, as in into the bones and the teeth, rather than the soft tissues. So you need to be taking a good amount of vitamin K2 in order to absorb the calcium correctly. Yes, that's a very brief overview. Vitamin D is really, really important. Deficiency is literally an epidemic, apparently, officially now, vitamin D deficiency, and it could account to a lot of ill health and a lot of problems. If you're going to get it, I'll put a link. This is the company I get a lot of my supplements from, and a lot of chiropractors use this company as well. It's called Cytoplan, and they're a British company that do really, really high quality stuff. They've got a lot of information on their website you can have a look at regarding all sorts of health issues. Really recommend Cytoplan. Like I say, a lot of health practitioners use them. It's a professional company. And if you're wondering if you're vitamin D deficient, if that might be explain any of the symptoms that you're getting, because general aches and pains, lethargy, and also muscle weakness are symptoms of vitamin D deficiency as well, which of course we see a lot of, then talk to your practitioner and you know, potentially go and get a blood test as well, find out. But when you get the blood test, ask for the number and the units. So we want to know the number and the units, not just, oh, they said it was fine, because that's really important, because the number will determine how much you need. But if you're not sure what your number is, the sweet spot, which is safe enough for everybody to take, but enough to get even deficient people up to the right level, is 4,000 IU. Like I say, most of the bottles you'll find in the chemist are 400. So instead of taking 10 tablets, just buy the 4,000 one, then you only have to take 1 tablet. And that's a lot of information, I know, but I thought it was a really, really important supplement, really important vitamin that you needed to know about. If you've got any questions about any of that, like I say, come and talk to your practitioner or stick them in the comments, and I'll see you soon. Take care.